I'm Jeremy Brown. I am the Medical Director for Hospice of Lubbock, and I also work in the Inpatient Palliative Care unit with the palliative care team. Our job is to come in and try to find a holistic approach, a interdisciplinary approach to treat those symptoms and ease the suffering of the patient.
My name is Bobby Sanchez, and this is my father, Alfredo Sanchez, and we're here to talk about our experience with palliative care with my mother, Margarita Sanchez. We've been fighting the battle for 3.5 years. Our experience that we had with other facilities, it seemed like we were just a number. We were just another patient. But when we came to Covenant, it was, the nurses knew my mother's name. They knew her history. They treated her more as a person, not only a patient or a number, but as a person. Once they attacked the comfort measures when we got into palliative care, she was a completely different person. So it was a very positive experience for my entire family because we got Margaret back. We got Mom back at that point.
In palliative medicine, when we're talking about symptom management of our patients, people have this perception that we're the death squad, that, oh, here comes palliative, somebody must be dying. And we argue against that because we really feel like it's about living. And I think that's what draws us to palliative medicine as clinicians, as practitioners, as our interdisciplinary team, because we see those benefits. We see that we can give people a quality of life, even though we know that their time is limited. How they live in those last days and hours, it's important to us, and it's something that we strive for day in and day out, is to individualize our care so that each patient gets what they want out of the time that they have left.
I think that I kind of pushed the care treatment into trying to sustain her, keep her alive. But that wasn't my mother's wishes. So when Dr. Brown rounded one day that I wasn't there, my mom expressed her wishes to him, and that's what he did. He focused on the patient. I'm glad that that was the path that they took. So we're driving home, and my mother opens the window, and the breeze hits her face, and she sits there and she's like, "Oh, that feels so good." So I told her, I said, "Let's go to McKenzie Park. Dad's behind us." So we drove to McKenzie Park. I put the top down. Dad followed us over there, took some pictures in the car, and spent 30 minutes out there, and then went home. Family came in that evening. Mom was lucid the entire time, enjoying family, ate a little bit more than what she had in the hospital, and then that evening she went to bed and never woke up the next morning. So we were blessed with a beautiful experience taking her home.
I was real pleased with all their services. You helped out a lot. You sure did.
Those of us in palliative medicine recognize that there's a difference that we can make. I think it's some of the truest medicine that you can practice. We walk into our patients' rooms kind of understanding that it's a sacred encounter, that there is an opportunity for healing, and there's an opportunity for living. And I think those of us who do it on a daily basis recognize the sacredness of that, and it's a responsibility that we don't take lightly.